Assalamualaikum. Today, my group would like to present about sialography. These are the contents for today's slides. We have introductions, indications and contraindications, anatomy of the salivary glands, patient preparations, procedure, pathologic appearance, and aftercare. Sialography is a radiologic examination of salivary duct and glands with the use of contrast media. Other than that, sialography is also used to show such conditions such as inflammatory lesions and tumor, which to determine the extent of salivary fistula and to localize diverticular strictures and calculi. These are the suspected indication for sialography. We have suspected stones or calculi, for example, sialulitis. And then we also have obstructions or strictures, infections, masses or tumors. These are the contraindications for sialography. As we can see, we have pregnancy, allergic to contrast media, inflammation of salivary ducts.
As for the anatomical part of the salivary gland contains three major cells such as acinal cells, ductal cells, and myoepithelial cells. Dispersed of their different locations, each of these glands shares the same fundamental structure functions such as branch ducts that open into the oral cavity of the glandular secretory end pieces, which is also called as acinal that produces saliva. On the other side of the anatomy, we have the parotid gland. Parotid gland is the largest structure of salivary gland. The structure lies right below the ZYGH, which is at the front and below of the ear. Parotid gland, which is also known as the Stenson duct, is literally 5 cm length, and it runs over the mesterus and it opens the oral vestibule opposite of the second upper molar. And then we have the sublingual gland. Sublingual gland is a structure located on the floor of the mouth, which is also called as the surface of myeloid muscle. The dust of the battalion is an element structure which helps to empty the submandibular dust. It also ducts of the ravenous, which is a numerous element of small substance dust which helps to open the mouth, the top of the mouth. As for the submandibular gland anatomy, it is a structure that is located posteriorly extended from the first lower molar to the angle of the mandible. It's a part of a soft tissue on a medial. As for the anatomical part of submandibular gland, it is a structure located posteriorly extended from the first lower molar to the angle of mandible. A part of soft tissue on the medial major of mandible and hyoid bone. Watton's dust is 5 cm length and able to move forward, medially and upward. It is also able to open the mouth on the side of the phalanx. As for the preparation part for this procedure, we would ask the patient if they have any allergies. If the patient is believed to have any previous history of allergies, we would provide with prevention injection such as hydrocot just to prevent the patient from having any reactions to the contrast provided. As if the patient, we also would ask the patient if they are having any medication prescribed by previous medical history, just to inform the patient that their medical schedule will be interfered during this procedure. As we also will make sure if the patient is believed to be pregnant or currently pregnant by also asking when is their last LMP. We would suggest and we would advise the patient to bring in a guardian or a friend during the procedure. This is because during the procedure, the patient will be given a sedative injection just to calm the patient. And after this procedure, the patient is believed to be still having some dizziness and unable to drive themselves from one location to another location. And other than that, unnecessary typical preparation will not be needed for the procedure of sialography. For the procedure of sialography, the procedure typically takes about 30 minutes and it may take any longer if the dust opening is difficult to locate. The doctor and the X-ray technician will perform the sialogram. They will start the procedure by giving a germ-killing mouthwash. They will also sedate the patient to remain calm, and strong sedation will be given if it's necessary when the patient is unable to remain calm during the procedure. The patient will be positioned in a supine position on the X-ray table, and the patient will be asked to open their mouth very wide. While this procedure, no numbing agent will be given, and the procedure only minimally gives discomfort to the patient. X-ray will be taken and it will show if there is any stone that may prevent the contrast material or dye from entering the dust and reaching the gland. As a continuation of the procedure of sialography, the doctor will place a small flexible tube called catheter inside the opening of the salivary ducts and also ask the patient to hold the tube in place. The technician will inject the contrast material into the dust and the patient will experience pressure and some discomfort during the procedure. After the dye fills the salivary gland, it will be visible by the X-ray. The doctor may need to examine the patient's salivary gland from the different angle, which makes the patient to turn their head into different direction and also need to hold their breath periodically, which helps the patient to stay still for the X-ray procedure. A glass of lemon will be given to increase the amount of saliva in the mouth, and it helps to take additional images to observe how the saliva drains from the patient's mouth.
Jumping into our next talk, here are a few radiographic images of the parotid gland. There are 3 views taken, and the first view is the AP view. For AP view, the patient lies supine with the head on top of the IR. Make sure the head is straight with the OML perpendicular to the cassette. The second view is the lateral view. For this view, patient has to lie down in semi-prone position and place either the left side or the right side of the chin on top of the image receptor. Extend the mandible to avoid cervical and place the IOML parallel to the image receptor. Final view is the lateral oblique. The patient has to turn their body to a semi-supine position with sponge under their head as support. Once again, the image receptor is placed under the patient's head with the head rotated and chin extended on each side. The central ray is angled 30 degrees cephalic to interpupillary line. So this is what a healthy parotid gland looks like, and it appears like a leafless tree. Next slide will show how an obstructive and inflammatory disordered parotid gland look like. The first example is sialolithiasis. It has an oval-shaped radiopacity appearance, resulted from stone or calculi formed in the glands, blocking the saliva flow. Parotitis is a painful swelling of the parotid glands. Here we can see the image shows an enlarged duct appearance. Next, salivary duct stenosis is the second most frequent obstruction due to the focal narrowing of the duct. So the procedure is fairly simple, therefore there is not much aftercare needed unless giving antibiotic or anti-inflammatory drugs if sialaginitis occurs. Other than that, patient is allowed to leave.